talk, say you love me, oh. If you don't love me, oh, then you don't talk, say you love me, oh. If you don't need me, oh, nobody talk, say you need me, oh. I take this love, oh, seriously, oh. You know, if you need, you don't finish me, oh. Nobody talk, say you need me, oh.
Solutions 939, baby. Get ready to supercharge your life as we dive deep into the latest trends in health, expert insights, and practical tips to help you live your healthiest and happiest life. Catch the rhythm of wellness with Vic Riches on Solutions Clinic every Monday from 10:15 a.m. to 11 a.m. on Solutions 93.9 as we journey into the world of nutrition, fitness, mental health, and other holistic approaches in the world of health. Don't miss out on the valuable information that can transform your well-being, because a healthy life is your ticket to a wealthy life.
Hi, my name is Lydia Kioma and I'm a formulator. Ways to have a great skin. First, know your skin type. When you know your skin type, you'll know the kind of products to use. Then build a routine. It's important you build a routine. By that, I mean cleanse your skin, moisturize, exfoliate, and protect your skin. And lastly, drink water. People say drink water and mind your business, but really, you have to drink water so your skin is hydrated. That way, you have a great skin. Keep listening to Solutions Clinic on 93.9 Solutions FM. Thank you.
The World Health Organization says that 1 in 4 people are at risk of a mental health problem. With these statistics, it's important to take care of your mental health, because your mental health is also as important as your physical health. You are not alone. Seek help. Your mental health matters. My name is Chioma Fakuride. I'm a wellness consultant and founder of Olama Cares Foundation. Keep listening to Solutions Clinic on Solutions 939 FM.
Cheerful, the day is bright, it's bright and fair, a new day has come. Cheerful, I'm leaving my past behind, tomorrow is the future, today is right now. Cheerful, the morning has come. The morning has come. Mama, your love rice, why your temper they rise? If you no sell today, tomorrow day. Auntie begin, Johnny leave you a car, but this load where you carry no be only you a car come. Oh God, driver, the race is not to the swift. Take come slow and steady, your own passenger go enter. I ain't where only liar. Et you got boo et your ma. Cheerful. 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 Someday, someday, this goes sweet as is sweet before. Cheerful, you go marry that girl, you go buy that big house. Oh, cheerful, cheerful, as you start this year, you go end them well. Oh, cheerful.
Yeah, it's a new dawn. It's a beautiful week already, and that's our profession as we go into this wonderful week. The 23rd day in the month of October 2023, and that's a beautiful song by Jadis called Cheerful, which means a new dawn. Welcome to yet another interesting edition of Solutions Clinic, where we talk about everything and anything health. My name is Vic Richards, and best believe you're in for an informative session right here on Solutions Clinic. Welcome to the show. Like I mentioned earlier, today we're going to be discussing easy insights on how to prevent breast cancer. As you know, it's the pink month. Alright, the month of October every year is known as the Pink Month for Breast Cancer Awareness. And this annual campaign is aimed at raising awareness on the impact of breast cancer, promoting early detection, and supporting individuals and families affected by the disease. According to the WHO, 685,000 people died from breast cancer worldwide as of 2020. Approximately half of all breast cancer cases affect women who have no specific risk factors other than age and gender. And breast cancer occurs in every country in the world. The theme for this year's campaign is "No one should face breast cancer alone." Joining me this morning for this conversation is Dr. Chukwuma Okoli of the Metropolitan Family Hospital, Ibadan. Good morning to you, Doc. It's great to have you join us.
Good morning. Thank you.
Awesome. All right, let's start off the conversation already. Breast cancer. It's not new. It's something that we're very, we're very, 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 what's the word now? Familiar with. Thank you very much. And I think that's because it's a month where it's a center of conversation. We must definitely speak of it. And I want to start with what predisposes women to breast cancer. Just as the WHO said, there are no known risk factors, as it were, other than age and gender. Yes.
Gender,
so let's talk about other maybe modifier risk factors that exist.
Well, I would start with hormone replacement therapy for people who, for one reason or the other, have to be placed on estrogen or progesterone, possibly after menopause. So maybe for one reason or the other, and they had issues, and then the doctors have to prescribe these medications again. So hormone replacement therapy is part of the risk factors that one can see, and they are modifiable, because if you don't use them, you may not be at risk. A lot of people have associated things on sizes of the breast. It does not follow. We've seen people with very tiny, almost dried breasts, we can call them postmenopausal breasts, yet they still develop breast cancer with it. Yes. And then we've seen people who are very busty, and I mean busty, and they grew old and nothing happened. Other factors could be alcoholism, sedentary lifestyle, because even in Europe, studies have shown a 13.4% reduction in women who walk out, who are active, who are less sedentary. Sedentary means, let me give you an example. You wake up for the day, start the job. Wake up, start the job, and then you spend the whole day at home. All you do is just probably do some house cleaning and stuff like that, and when you're done, you're home. You really don't have any reason to step out of the house. So you see, yeah, so that in itself is a sedentary lifestyle. So I listened to a commentator this morning who talked about when you eat the food, then walk the road. And it made me realize, wow, so you need to, so like those joke people used to say, it is the rich that remember to walk after eating. It cuts across everyone. Yeah, it's not the rich alone. No, you have to walk. You have to be active. Okay, that way it's preventive of a lot of things, not just breast cancer alone, but then obesity. And yes, obesity is a risk factor they are trying to work against, because obesity opens the door. Guess what? Not just for breast cancer, but diabetes, for hypertension, and so many other conditions. So it is, it's all encompassing. Okay, so we talked about alcoholism as well, which is modifiable risk factor. So those are the modifiable risk factors in a nutshell, because these are things that people can relate with. Okay, for those of you who love to drink because you think it takes away your sorrow, it may take away temporarily, but it will give you a lot of things in return. So it's better to stay away from alcoholism. And then the sedentary lifestyle I talked about, okay, the hormone replacement therapy I talked about. So these are the things.
All right, you've heard from the doctor this morning. These are the, possible risk factors that can lead to that, if not modified. All right, we're going to talk about these and more, but right now I also want to remind you that we're streaming live on Facebook as well as YouTube at Solutions 939, so you can do well to jump in on these platforms and drop your questions if you have questions relating to breast cancer. Otherwise, you can send us a message via WhatsApp or regular text to 0904 422 2939 0904 422 2939. What are the symptoms women should pay attention to as it concerns breast cancer?
Well, of course, symptoms vary, but the commonest is a lump in the breast, which is common. Okay? And the lump in the breast doesn't always mean it's a breast cancer. It could just be a fibroadenoma, which people call breast mouse, because as a doctor, while you're examining it, it keeps trying to evade your fingers. It runs,
It moves around.
Yes, it moves around. So that's why they call it breast mouse. Okay? Right. So not every breast lump is a cancerous one, but it is necessary to bring out every lump and check. Okay? We know somebody in the recent past who had a family history of BRCA1 and 2. Those are the breast cancer gene. Okay, call it BRCA. I used to call it BRCA gene 1 and 2, BRCA1, BRCA2. Okay, and then when she realized she had those, she had her breast removed. Though some prodigies felt she was being overzealous. But I just felt like it was comfortable for her to get it out, and the husband has nothing against it, so it's fine. It's her decision. And fine, we have some of those genes that are harmless, and we also have the virulent ones. Now, you don't know which of them will turn in to become a breast cancer. And so she took the easy way out, which is, is this what is going to cause problem for me? Let me bring it out. And she had her breasts removed. Okay, now the thing is, when you notice some of those lumps, okay, aside from the lump, the skin over the lump has this, of course, we all know orange, the back of orange, okay? That's what they call range. Okay, it looks like the skin at that point looks like that of an orange when you see those things. And then occasionally you could have a bloody nipple discharge or a nipple discharge after menopause, because of course you're not breastfeeding and nothing.
So it shouldn't be happening.
So it shouldn't be happening, and all of a sudden your breast starts producing discharge. So if you have your last confinement or your last child was like 10 years plus ago, and all of a sudden you notice a lump in the chest, in your breast, and then you notice that the back is like that of an orange and possibly a discharge, whether bloody or not, you may likely be in the line of a breast cancer. In that situation, you need to get yourself checked and assessed ASAP, as soon as possible.
Speaking of getting yourself checked and the lump in the breast, first let me start off with this.
Okay.
Is it possible that there's a lump in your breast and you wouldn't know?
Yes, people don't know what is called self-breast examination. Now, one of the problems we have in this world today is that people pay less attention to health programs. All you want to do is go on internet and watch reels and watch comedies. They are interesting. But please, when you hear a health program is being advertised, Pay attention. It might not be for you, it might be for that little girl or that boy beside you, someone beside you.
Absolutely.
And allow me to tell you that breast cancer can also involve men. It's not just women alone. And why? Because we have a little of fat tissue and then the areola stuff on every man. So everybody's involved. So if you notice a lump in your breast, please get to the hospital and get checked. So now, and the awareness is the issue. Now we need to publicize the fact that breast cancer is real, and many people are turning up with it, and that's because of poor self-breast examination. It's simple. As a woman, you should examine yourself. It doesn't even take more than 2 minutes to do. Okay, you wake up, get yourself seated before the mirror, and then put one hand at the back. So the hand you're putting at the back is the breast on that side that you examine with the other hand. And you do so. When you're done with that, you put the second hand in the back and use the free hand to examine your breast in 4 quadrants. That means you divide your breast virtually into 4. Upper 1, 2, lower 1, 2. And you do the same for the other one. Upper 1, 2, lower 1, 2. What do? You are pressing to see if there's any lump or mass. And if you find such, it's simple. Have your bath, get dressed, go see the doctor. That's it. So everybody should do a self-breast examination. Don't wait for anyone to do it for you. That's why it's called self-breast examination. It's important. And every woman must do it, so long as you have a piece of breasts or breasts on your chest.
You have to do it.
You have to do it.
Fair enough. Early detection is said to be one of the major ways to winning breast cancer.
Yes.
So it brings me to the question of, regular screening, self-examination that we just spoke about. How often should, women do this?
As often as possible. How often do you have a shower?
Well, every day.
Yeah. Check yourself. Every day.
No, for the screening where you for detection, it means you've discovered you have cancer, for instance, right?
No, you may not be able to diagnose yourself of cancer, but at least you diagnose yourself of a lump in the breast.
That will lead you to
go to the physician for proper clinical diagnosis.
Fair enough. I remember the time I treated exclusive breastfeeding, and it was said that also prevents coming down with cancer.
Well,
Let's talk about that.
Thank you. Exclusive breastfeeding is preventive, and even pregnancy is preventive. Yes, so it's not common to have a woman who is pregnant come down with breast cancer. Right, pregnancy is just 9 months, okay? And then once you start breastfeeding, you're sure that for the next 2 years, so 2 years plus the 9, making total of about 3 years, you are free from having anything related to breast cancer at that point. So yes, it is protective, because that process does not allow, if there were genes in the system that may turn cancerous, the process will not allow that to happen. So it's protective.
Fair enough. So all women should embrace exclusive breastfeeding.
Yes, should.
Because there's been a lot of argument about exclusive breastfeeding as well. Not a lot of women indulge in it.
Well, for their aesthetic reasons, but however, the benefits far outweighs the risk. So if you ask me, I'll tell you that you should get yourself to breastfeed your baby. Unless you are not able to by medical reasons, it's quite understandable. But so long as there is fluid, there is milk in those breasts, and there is a baby crying around you who needs it, please
feed them.
Feed them.
You talked about gene. I mean, you've mentioned it a couple of times. Is it that if there's a history of that in your family, there's high propensity of you coming down with it?
Exactly. In fact, family history puts you at high risk. Everybody should check themselves. But of course, if the family history puts you at high risk. Like this person, the family, in fact, a direct relative had, so she had to get her breast out before she was diagnosed. Because I think the mother was diagnosed. So for that fear, she had to get her stuff out even before anybody talked about it.
Other than getting the breast out, are there other ways to probably have the breast on and still survive it?
Well, now of course, the truth is, if there is a breast lump, and then it was detected early, and that's a part of it, early detection, okay? As you present early, they detect early, advice is a radical mastectomy. You remove the breast.
That's the safest.
Yes, get it out.
Okay. I've also learned that there are different stages to, breast cancer.
Oh, yeah.
Can you walk us through that?
Yes, we have the early stage. Then everything is dependent on the time of presentation. We have the early stage. Okay, we have the late stage. Right. Yes, and there's a thin line between early stage and late stage. So long as there is no spread, it's still in the early stage. We have cancer.
Okay, so it spreads.
Yes, it does.
Wow.
It does. It's just from the breast to the chest.
Not like
wall
it
to the
grows. I
lungs.
think the lumps just made
Sometimes just above 5 centimeters, it would have spread.
Wow.
Yes, a lump. So don't wait and say it's not yet up to the size of my fist, so there's no problem. Something just above 5 centimeters, the cancer cells will breach the capsule, and once they breaching the capsule means going through the capsule. They've spread. Once they get to any point, that's a spread automatically, either to the lungs or to the liver, or to the brain, name it. That person is a goner. Yeah, so early detection is better, and we're talking about when the cancer cell, when the lump is still less than or equal to 5 centimeter in diameter. And 5 centimeter is just the size of an adult thumb.
Yeah.
That is it.
So for the men, which has been raising a lot of conversation, you already mentioned that earlier. Is there a reason that happens other than the cell? I think you talked
Yes,
about.
many times it's always lymphatic related. That is, everyone knows about the artery, we know about the vein, we know the nerves. There are other vessels called the lymphatic vessels. They carry the lymph, okay, that flows and that participates in the immune system. The advantage is that it takes care of, like I said, the immune system taking care of destroying bacteria and all that. But once there's a cancer cell, they also use the same route to spread from one point to the other. So for most times when men come up with, the few ones I've seen have always been cancerous. The few ones are, yes, they were cancerous. So at the end of the day, men are good at one thing. They are good at ignoring.
Yes.
Yeah, we know how to ignore. We know how to look over things and pretend like we didn't see anything. Meanwhile, we saw. Of course, let's be careful. If you notice any lump, no matter how small, get to the hospital. There's something called fine needle aspiration cytology. They will take a very little quantity of the stuff and check. And if there's any issue, they take it out before it even becomes an issue on its own.
Oh, well, you're listening to Solutions Clinic right here on the Remedy Dial Solutions 93.9, and we're talking about breast cancer, is an insight on how to prevent breast cancer. And we've addressed a couple of issues. Shortly, I'll be taking questions. So if you want to send that, please do to 0904-422-2939. You can do this for WhatsApp and regular text messages as well, because I'll be reading that in a bit. We're also streaming live on Facebook as well as YouTube at Solutions 939 FM. So do well to jump in on the platform and lend in your thought as well, so we can address it as we go on with the conversation. All right, I saw this particular one on Twitter because I did join a space a couple of days ago that treated breast cancer, and someone mentioned, women using deodorant, that spraying of deodorant could the toxins in it. The question was kind of sketchy, but I think I get the information she's trying to, or the question she was trying to ask, because we've heard about how some of these products that you use could lead to cancer. Cream, for instance, I don't know, skin cancer and the rest. So I think that led to the question of if, spraying of deodorant around the arm could lead to that.
Of course, I just want to suggest that one should be very careful how we use the internet spaces to propagate things that are not clinically confirmed. Proven. Let's leave that to the experts. As we speak, we have experts who work day in, day out on several areas, okay, in order to, it's just like you would wake up and tell us tomorrow that McLean's will lead to cancer of the mouth. I mean, or mouthwash will lead to cancer of the mouth. I don't want to toe that line, because I would like the experts to in that regard. So I don't think it's ideal to come up saying deodorant will lead to this, lead to that. No. If you don't want to use deodorant, just tell people you don't want to use it because you just think you're not comfortable with using it. But don't associate it with a cancer if it hasn't been proven. As of now, it has not been proven that deodorants will cause cancer of the skin. And we're talking about skin, not even breast.
No, she was even referring to breast, as it were.
No, that's what I said.
Okay, okay, not even. Okay.
You're talking about skin cancer. Okay, I would say if you have a risk factor for it, then you should be careful the things you rub on your skin. Okay, for instance, people who do tattoos, Okay, we know about a few popular people who had a lot of tattoos and some turned
Absolutely.
up with skin cancer. Okay, that's probably because they had a gene that could convert, okay, to his cancerous skin, and they now started pushing in chemicals, inks underneath the skin. It will trigger the growth of this. But in the absence of those genetic tendencies, it's not safe to say that usage of body sprays and all that could turn up and give you cancer. Let's have your journal and where it's coming from, and then we read through and educate ourselves.
Absolutely. So, for all this, that's a myth. All right, let's start taking in questions. This is a question from Simi, and she says, I have a mobile lump in my breast, and after screening, it was discovered that it wasn't cancer, but I live in constant fear as I lost a sister to breast cancer.
Wow.
What can I do?
Look, we just talked about this now. Family history. Please, if you're listening out there, get that lump out. I mean, you have a family history. Oh, I'm really sorry that happened, but please, get the lump out. Don't keep it. If you lost somebody, a loved one to it, come on. Get to the hospital as we speak now. Go. Get up. Go. Get it out. Please. Thank you.
Quick question. So the lump that wasn't cancerous
Yes.
can actually turn out
Turn.
to cancer?
Yes. I lost a very beloved one to fibroid turning cancerous. Fibroid becoming cancerous.
Okay, because I've heard about, when you go to the hospital, you mentioned it yourself, that it's not harmful. So why do they tell patients at the time that, oh, it's just a lump, it doesn't mean anything?
To lay out the fears, okay? Yes, so that they don't go from not having a blood pressure to having a blood pressure. But in that regard, so long as there is a family member who was lost to breast cancer, and a doctor still knowing this ought to have told you, madam, it's and then to say it's not cancerous, what investigation was done? Was it an ultrasound that was conducted, or a fine needle aspiration cytology? Because if it is if it's a biopsy, excisional biopsy, excisional means to exit, to remove and go check. But probably she said it was checked and she was told probably a scan. Please do a fine needle aspiration. If you don't want to go for surgery, then get an FNAC done. And what's an FNAC? They will put a needle through and take a sample. Why not just get it out? It's still the same process. It's still going to have a pin or needle or a knife or something cut through you. Why not just get it out and then check?
All right, here's another message from Neka. Good morning to you, Doc. My question is, does pimple and bumps around the breast mean anything? Should I pay attention to it?
Thank you. Are the pimples are bumps just around your breast? If they are, then go for a scan and let's see. That's a breast scan, ultrasound. Okay, and if you're above 50 years old, go for a mammogram. But if it's the pimple and stuff are everywhere around the body, then it's fine. There's nothing to worry about. It's just on the skin, and the skin covers everywhere. Okay.
All right, another question here is from Tayo, and he says, Doctor, you didn't talk about vegetable oil and fatty food. Does that lead to anything? Because I've heard that consuming a lot of vegetable oil and fatty food and sugar could lead to breast cancer.
But we haven't talked about healthy eating.
Yes.
Prevention. Yes, let's talk about prevention now. The diet and the lifestyle. A lifestyle of exercise, diet of eating healthily. And you meant to say granite oil, okay, because vegetable oil is safe, but why consume a lot of it? Are you drinking it? No, you shouldn't. You just put a little portion, just a little. You need to see how the whites prepare their stuff when they want to fry. Just a little.
I use butter for
cheese and butter mostly to fry. But vegetable oil is even safer, okay, compared to cheese and butter. That
people
is
even know the
fatty.
difference between vegetable oil and groundnut oil.
They don't. I'm sure they don't. they don't. Okay, so you have to eat healthily. Take a lot of fruits and vegetables. Okay, like I talked about obesity. Of course, something led to it. Obesity is either genetic or lifestyle caused. If you're there and you always mark, like Dr. So would say, you always mark whatever in Mama Nkechi's restaurant.
yes.
You always eat this, eat that. You eat the cow meat or whatever, the chicken, asun, suya, and all. Fine, you're enjoying your life, but then be careful, because all those things can push you to obesity. You have your place, you mark every night, you gather at one bar like that, and then you take 12 bottles and say you're enjoying. Please, enjoy your life, but enjoy with sense. Okay, you're writing letter to obesity, and obesity can lead to anything. I mentioned about hypertension, diabetes, arthritis. Of course, yes, it's a risk factor for breast cancer as well. So when you eat healthily, then you work out. Work out, I mean just exercise, trekking exercise, walking, running exercise. It's just as simple as that. You don't have to go do the weightlifting and then dead weight of 200 kg and all that. You don't need all that. Just an exercise. It will keep you healthy. So when you eat healthy, it also prevents breast cancer.
All right. So I feel tempted to open the phone lines because I know it's a conversation you might be very interested in and would want to ask questions. If you can, send a message. So if you want to call into the studio to ask about breast cancer, do call 0909-888-9939 or 0912-222-2939. 0909-888-9939 or 0912-222-2939. So these are the numbers to call into the studio, and let's have your question regarding breast cancer. All right, this is quite the question I have, and this is from Tolu, and it said, "Good morning, doctor. I heard, though, emphasis on the O, that sucking a woman's breast."
I was avoiding that.
Sucking a woman's breast reduces the risks of the woman coming down with breast cancer. It is what I heard.
Yes.
I only want to confirm, and I hope it's true. Wow.
There's always a level of truth in everything. So yeah, somehow
There's a truth in
just
it.
don't go sucking every breast you see. I beg go. No, there's some truth, level of truth in it.
Wow. That's a surprise.
That's why I said I was avoiding the question.
I don't even know how to react to that.
But it's
Oh,
okay.
really?
It's okay. All right. So
How does that help
can't
in
suck
any
your
way?
wife's breast. Simple. Okay.
Okay, your wife, just your wife's
I
breast.
don't just go.
Fair enough. So the focus should be on your wife. All right. Hello.
Hello, good morning.
Good morning to you. What's your name, sir?
My name is Samuel. I'm calling from Ibadan.
Samuel, great to have you. Let's have your question.
Yeah. I was listening to your program. I was following your program. Then I had to call you because my wife discovered, my child, well, I have 2 kids,
Okay.
and the younger one is 3 years old. So
Okay.
you should understand that, like, we gave birth to him like 3 years ago. And then my wife discovered a lump on her breast.
Okay.
But it's a moving one. And so she had to go to do a kind of scan, a test. And then they told her it's just benign lump. I don't really understand benign lump. Is it a risky lump? Should she go for a kind of removal of the breast or something? I need to know. That's what I'm calling.
All right, Samuel. Thank you very much. A doctor will address it, so keep listening.
Wow.
All right. If I understand, that's a boy, right? The child is a boy.
No, I think he's talking about his wife. I think he was making reference, just to be sure, of the time they gave
Okay.
birth to the son, and she
Okay.
now discovering the lump. You know, we
Oh.
mentioned
Okay.
within the time of pregnancy or
Okay,
lactation.
okay. So the lump is in the wife's breast.
Yes.
Okay.
Yes.
Benign. Like I said, this is where the issue comes up. How was the okay? She said a scan. A scan. Okay, agreed. A benign lump. There are questions to be asked there about the size of the lump and how old she is at the moment, and is she still going to have more kids? Because she said she had a boy 3 years ago. Okay, so these are the questions we need to know about. Now, I am more concerned about the size of this particular lump. I'm more concerned about the size of the lump. It could be said to be benign. Now, another question is this lump increasing stealthily, or is the lump the same in size? So at this juncture, I would rather they revisit the hospital for a reassessment. And all those questions need to be answered. If the lump is the same, like in the past 6 months, it's still that same size, still running around like the breast mouse I talked about, then no problem. If it is, and then whatever the size is will also determine. You tell me it's a lump that is more than the size of my thumb, okay, and has remained like that, I will tell you, okay, come back in 3 months for a reassessment.
Please just hold the thought. Let's go on a quick commercial. We'll be back. Just stay with us.
Hey, listeners on Spotify are driving Afrobeats to billions of streams. Now you can join in on the journey and listen to your favorite music without ad breaks.
Upgrade to Spotify Premium now and enjoy 4 months free.
One day, na so bag with plenty money just appear for inside one Olanrewaju compound. 2 seconds, everywhere burst.
Let me get a bag. Me nobody see my radar.
Hey.
Let me face him. Me cannot see you now.
You say waiting, as the landlord of this yard, so na me be the rightful owner of that bag.
Oga landlord, we could not find your size. We die here.
Have come on, see. Come on, you won't call it.
Now who come get this bag? Now for the new series, Akpo, we go know.
Follow the Yawa way buster. Sake of this bag where money full. On top the new Africa Magic Show, Akpo. Come see the long throat and Kasala way scatter ground. From 18 September, every Monday and Tuesday by 6:30 for evening. On top Africa Magic, Yoruba Channel 2. Go TV. Love it.
All right, welcome back. You're still listening to the Remedy Dial Solutions 93.9. This is Solutions Clinic, where we talk about everything and anything health. My name is Vic Riches, and I'm speaking with Dr. Chukwuma Okoli this morning, and we are talking about breast cancer. I saw that the phone lines were still buzzing, so to call into the studio with your questions, the numbers are 0909 888 9939 or 0912 222-2939. Doc, let's continue with your thought.
Yeah, so at this juncture, I still want to talk about, I want to talk about the size of the lump, okay, and then how long ago was this scan done. So if the scan was done in less than or equal to 3 months, then I think they should revisit. But of course, ask yourself basic questions. 1, any history of breast cancer in your wife's family? Then 2, any history of anybody with breast lump amongst her siblings? Okay, then if none of these have occurred, then pay attention to the lump size before and then repeat the scan after 3 months, check the size. If it is increasing, I would advise you get it out. But then, like you said, you've already described it. It's like a mouse, it's running around when you examine. Okay, that is a breast lump. Because it's not all the lumps in the wife's breast, in the woman's breast, are removable breast lumps. Some of them are just solidified milk cords. 3 years, so I'm sure she just finished breastfeeding in recent times. So some people could have that lump there and still breastfeed, okay? Doctor will tell them, breastfeed your baby after all, okay? It might not be anything serious, but then it's better to keep your eye on it and then do your regular checks on it. And if it's increasing in size, I would rather removing it and you have peace of mind thereafter.
All right, this is a message from Lovett. She says, good morning, Doc. My question is about the size of the breast. You said earlier that it doesn't mean one could come down with cancer. But I'm a very busty lady, and I have struggles examining my breast according to the 4. Yes. I think.
Yeah, all you need to do is help. Someone should help you. Okay. If you can get someone around who's that detailed, let the person do. If not, go to the hospital and let the doctors do that for you. But just get someone around to help you do it. And like I said, I've seen people who are lean body mass women, and they came down with breast cancer. Of course, we know this is more common in the elderly, but we have been seeing them now in the younger generation. So we still have to pay attention to self-breast exam. But of course, this is it. Will you be going to the hospital every day to check? No, you don't have to. So you can always look for someone you can trust around who would help examine your breast, and that's fine. And what are you even looking for? You're looking for a round lump that runs around, and when you examine, so
it's always mobile. The lump,
it's mobile. That's why it tries, to evade your hands when you are trying to locate it. So just get someone to help you do that. It doesn't necessarily have to mean going to the hospital. It's just that if you are not comfortable with your findings, then at that point you get to the hospital nearby and let the doctor see you. Remember, Let the doctor examine you with a chaperone. Thank you.
Okay. Does wearing wire bras cause breast cancer? I don't even know what wire bras is. This one from me, by the way.
I don't know what wire bras are, but by the way, you mean bras that have some nettles to help keep it in position?
Yes, something like that.
Well, they will only cause discomfort for you, but it doesn't cause breast cancer. It doesn't. It will just cause discomfort, around. And so. All
right. Let's talk about the treatment approach as we conclude and see if we get more calls. For calls, please call 0909 888 9939 or 0912 222 2939. You can send a message via WhatsApp or regular text with your question to 0904 422 2939. What are the treatment options for people already down with breast cancer?
Okay, for anybody and everyone that is undergoing the treatment, I pray for you that God will come true for you.
Amen.
They will go through, of course, radical mastectomy. That's removal of the breast tissue that is involved, and then they go through what is called radiotherapy or a chemotherapy, any of the two. Most people do both back-to-back, radiotherapy and chemotherapy. The goal of the treatment is to reduce cancer cells as much as possible and to see if it can be eradicated or to increase life.
Hello, good morning.
Hello, good morning.
Morning to you. What's your name, please?
Hello?
I can hear you. What's your name? All right, call back if you can, 0909 888 9939 or 0912 222 2939. Please go ahead.
All right. So the goal is to reduce the cancer cells as much as possible. So that's basically it. The removal, that's a surgery. Then a chemotherapy, they introduce some medications that are cancer-killing drugs, cancer cell killing drugs. That's the chemotherapy. And then they also do radiotherapy, that is they channel the machine to push in some radiations directly.
Hello, good morning.
Hello, good morning.
Good morning.
I do feel a little bit of pain from it when I press it.
A little bit of pain. Ma, please, how old are you?
How old am I? I think I'm 30.
30.
Yes.
Have you had kids? Has a child suckled on your breast?
Sorry?
Have you breastfed
a child before?
Have you breastfed a child?
I haven't breastfed, but am I supposed to discuss this thing on air? I haven't breastfed, but I think I've done B and C.
Oh, that's not an issue. That's not an issue. Why I'm actually asking is that if it's causing pain, allow me, ma, to say that breast cancers are painless. They don't come with pain at the early stage. Yes, ma, they don't come with pain at the early stage. So if you're having pain, ma, I would suggest if you repeat a breast scan again. Do a breast scan.
Maybe try different.
Yes. Do a breast scan, and then that will give you an idea as to what it is. If it's disturbing, because it might not be all. Like I said, not all the lumps are removable lumps. We have what is called fibrocystic disease of the breast, and that one comes with pain. And if it comes with pain, what you need is just a symptomatic treatment, not necessarily a surgery or anything. So that's why I would rather we repeat the scan and we know exactly. And it is scan. Most times they'll tell you mammography is for 50 years and above. You don't need a mammo. You need a breast scan. And both breasts should be scanned. And then let's know exactly what the diagnosis is. If it is fibrocystic disease, medications will work. And if it is confirmed the breast lump and it's painful, then you need to remove it.
Okay.
Yes, ma'am.
Thank you very much.
You're welcome.
Thank you. All right, we can still take one more call if we get that. Otherwise, we'll just conclude the show this morning. To do that, 0909 888 9939 or 0912 222 2939. The theme for this, Breast Cancer Awareness Month is no woman should do breast cancer alone. And more often than not, you see that when people come down with diseases, is that they're keeping it to themselves or themselves rather. And if they even tell family members, you see that they're also dealing with that in isolation. So let's speak to that.
Yes. Well, of course, breast cancer has its issues. A lot of the sickness is something that it affects the whole being. So anybody who is on treatment needs all the support in the world. So let's make do to come true for them. And if you are receiving treatments like that, except you prefer to stay in isolation, it's fine if you prefer to stay in isolation, because some people or most people will just spread information and do nothing about profiling solutions. And right here we are on Solutions FM, and that's what I would suggest. Prefer solution rather than spread the news. Okay, create help, create awareness. There is treatment for it. And it's not a death sentence. It is not a death sentence. If anybody has been diagnosed with breast cancer, go through the treatment, have faith, we trust God, He will come true for you.
Amen. Well, and at the point of making out, when he tries to touch her breast, she reacts in a particular way. And that was happening over and over again. And he thought to himself, that's why I asked the question earlier, is it possible for one to even have a lump in their breast and they wouldn't know?
Yes, it's possible.
Yes, and you said that was possible. Apparently, according to the guy, as he was touching, she was reacting in some kind of way. And he asked her about it and suggested that he took her to the hospital, and it was discovered that she had a lump in the breast that was cancerous.
Wow.
Yes. And, eventually it was removed. So if the guy, or if that didn't happen, of course, that shouldn't be the only avenue to know that. But if that didn't happen, and if the guy was vocal and encouraging enough to speak to the girl and take her to the hospital, perhaps should have just had that with her. And according to her, she was 27 when this happened. So attention to details, these little things really matter. You have a partner, pay attention to these things, encourage them if you find out that they have, and support them ultimately. And that's one way we can win, breast cancer together. Thank you so much for your questions. Thank you for listening. And thank you, Dr. Chukwuma Okoli, for always being here and supporting us with your wisdom, on health matters. I'll be back next week, Monday, same time, 10:15 down to 11 a.m. on Solutions Clinic. My name is Vic Richards. Have yourself a swell weekend or weekday or week.